You've heard a lot from me. I'm going to invite up to the stage Dr. Tamara Campbell, who has been an incredible advocate for this work, but most importantly for veterans in general. I want to read her bio. She was very kind. She said, you know, you don't have to read all of that, but I started reading it and I thought this was incredibly impressive. I have to read all of this. So Dr. Campbell is responsible for the development, implementation, and operational integrity of the VHA programs that provide veterans with access to a full continuum of integrated mental health care and suicide prevention services. Key services include immediate crisis intervention, facility-based same-day services for emergent needs, sustained access to a variety of services to support wellness, and a broad array of web-based resources for veterans, family members, and community partners. Dr. Campbell is a mission-driven leader committed to engage in veterans with lifelong health, well-being, resilience, and one of my favorite facts, Dr. Campbell is a United States Air Force veteran. So I'd like to invite Dr. Campbell to the stage. Yeah, easy. Do you have slides?
No, I don't have slides. So thank you so much. It's an honor to be here this morning, and she was asking me if I have slides, and I said I will not be the one first thing in the morning, death by PowerPoint. So that is not going to be me. It's an honor to be here and a privilege to work with this team. So I had an experience a couple of days ago. I was walking down the stairs and my leg gave out, and because I'm getting older. And so I'm thinking today, I just hope my leg doesn't give out on stage here. And I'm sure someone in there has some help for me in terms of meditation and how to relieve anxiety, et cetera, et cetera. So as I mentioned, I'm Tamara Campbell. I'm a practicing psychiatrist. I still see patients. I'm the executive director in the Office of Mental Health. Huge undertaking, very humbling experience, and very rewarding experience when we can do things like what's happening with technology and immersive treatments. As was mentioned, I'm responsible for a full continuum of care that goes from self-applications to VRE to certainly our most high-risk patients that we are able to take care of on our inpatient units. There are about 9 million veterans enrolled in healthcare. About 33% of those veterans are seeking mental health. And so that's why it's critical that we partner with the latest technology. People are dying. People are dying unnecessarily. We know that lethal means safety is critical. We're able to leverage immersive therapy to help with that, treatments to help with that. We also know that people are dying from accidental overdoses. They don't want to die. They build up a tolerance, right? And they have a stressful situation, and you get tunnel vision, and you do anything to relieve that. We know there's a space here for immersive treatment to help our veterans. PTSD. So I'm telling you, the higher you get in education, the more skeptical you probably become, because they like to sue us. People like to sue us. And so we want to be careful, right? We want to be careful that the data is there, that we can say we prescribe something or we advise something because there's evidence base. So we know that we are starting to see the data in this space, that we are seeing evidence-based implementation, that we never go it alone, meaning that there are clinicians on the team. So I had the pleasure to meet Jared this morning, also known as the psychologist who's not afraid to corner the executive director and let her know where things are and what we need to look for and what I need to advocate for. I mentioned I still see patients. I do that because, one, I enjoy patient care, and two, it reminds me about the decisions I need to make for these veterans. Immersive techniques we're finding in the space of whole health. Whole health is one of our strategic priorities in VA. Within the Office of Mental Health, implementing and supporting immersive techniques is also one of our strategic plans. So it all works together, but it's such a huge system in VA that communication and collaboration so that we're not duplicating efforts is critical. But the research is coming along very nicely in this space where we have our most vulnerable patients. And we do not want to replace the core evidence-based treatments. We still need them, right? But we need everything we can because one death for whatever reason is just one too many. And we can't afford in this country where we are well-resourced not to leverage all the people we can, not to leverage all the technology that we have. We are a multi-generational workforce, right? So we want to hit every age category. We don't want to leave anyone out. That means that we need the voice of youngsters. I call them youngsters now, because my daughter, who has to work all my technology, is like, what kind of doctor are you? Don't you know how to work this? I'm like, no, sorry, I went to school where you sat behind a desk. I remember growing up where there was a phone booth. I didn't have a cell phone growing up, but we need her voice. We need her generation because she knows that technology. I was talking to Dr. Bailey about education and training. There's not enough of us to go around to do supervision. So we need to figure out how to do supervision in this area. We need to have an experience where people are in school, and while they're in school, they can get an experience of what it's like to be a psychologist. What is it like to be a peer specialist? What is it like to work in mental health? Because I can't go to all the universities across the country. So we can leverage technology to do that. But we also need people in my generation and older, right? Because we need to know where we have to meet you. What is it that you need? We're veteran-centric in VA. What type of technology is going to help you? It's different for a person living in a rural community versus one that lives in an urban area where you have a metro system you can get to. Very different needs of those populations and demographics. We need to make sure that we're culturally competent, right? This is a beautiful country with all different kinds of people, and there is a place for everyone in terms of treatment if you need it. There is a place for everyone in terms of if you have an idea that you'd like for us to consider. All hands on deck in this space of mental health and suicide prevention. We can't afford to lose any more veterans, and we cannot afford for people to feel in any way that they don't belong. And so this is a way, this is a piece of technology, very important, that we can leverage to get to our rural communities, to get to our academic institutions, and to look at different ways outside of the medical center. So the majority of people we know that complete suicide have not had any contact with mental health. They may not have had any contact with the VA at all. We know that there are financial stressors. So in what way can we leverage this immersive technology to help individuals who are having financial stressors? to help individuals who are having relationship issues, right? Because that is what makes an individual high risk. A person may not even have a mental health diagnosis, right? Or they may have had some type of procedure or maybe had a fall, right? And then developed chronic pain. Maybe they needed a pain medication, took it a little bit longer because they didn't have other mechanisms to cope, right? And now we have a problem. Well, I think there's a place for immersive technology in that scenario. Let's not forget about spirituality, right? Because many of us have some kind of higher power or spiritual belief. That's an important piece of people's lives. How can we leverage immersive technology where spirituality is concerned? I'm not prescribing to any particular religious denomination, but spirituality is important to most of us, right? So we want people to define what that means for them, and then we develop the technology to help them. I think it's a wonderful space that we live in. We have a lot of challenges, but if I have to have a challenge, I can't think of a better country to have a challenge in, where all kind of people can come together, all kind of brain power comes together. We don't care what kind of degree you have or don't have. If you have an idea, we want to hear it. And with that, I'll say enjoy the next couple of days. It's an honor to be here and partner with you, and I'm looking forward to what the outcome of these 2 days will be. Thank you so much. Have a great day.